Hello everyone, you are all welcome to lecture number 1198, and today's topic is in continuation of causes and preventive measures uh, for childhood myopia, or you can say the treatment. It is part 2. In part 1, I have already discussed in previous lecture lot of global statistical data of different Asian countries and how the whole world is suffering today from childhood myopia. Actually, many of the students, they ask me about the word myopia. Some of them, they said that first time they are hearing is scientific word. So let me make it very clear. Myopic condition of eye means when your child cannot see properly the distant objects. It will be blurred, cloudy, dull, and it will be difficult to identify. That condition is called myopia. And this myopia condition happens when the focal point in the eye is short, means it is before retina, it is not reaching to retina, so that your optical nerve can carry to brain and child can see the image. That condition is called myopia. And nowadays in the world, there is increase of childhood myopia, and this myopia condition, all the pediatricians, they must be knowing that when child is born, all these their lenses, cornea, eyeball, they are all loose, and it takes almost 2 years to stabilize. So newly born child is in myopic condition. He is already suffering from myopia, and it takes almost 2 years. After 2 years time, he will be in position to fix the image that is at long distance. By that time, their nerves, their muscles, ciliary muscles, optical nerves, then eyeball, cornea, they will be in proper shape and they will be strong. So that is the concept of myopia. Now today I am going to discuss mainly the causes. So globally, scientists, they have three theories. One they believe in, that is called DNA, genetic material. First is that is DNA is responsible, that is genetic factor, and second is near side work, and third is outside work. So your child's myopic condition is determined by these three factors, and mainly I can say that it is lifestyle factor, because this genetic factor, that is DNA, is not very much dominant. Once the lifestyle, every day how your child is behaving, if he is taking care, then that problem will be over. The reason is that statistical data I have already discussed, that some 40-50 years ago, the childhood myopia in most of the countries globally was between 3 to 4% of the population. And today, I have given the example of Japan, China, South Korea, Taiwan. It has crossed the limit of 90. In most of the countries, they are in double figure, means 22, 23, and by 50, 2050, most of the countries, they are crossing 70, 80, is very much alarming. So we have to take measure, and we should know how to treat. And this myopia condition is irreversible. And if in the beginning some measures are not taken, preventive measures, then it may lead to glaucoma, to retinal detachment, and finally blindness. So this is, very, very important to take care of this condition. So the first condition was scientists. They were believing that it is not avoidable because those parents who are having already myopia or eye defect, it will transfer generation to generation is wrong. Because in Alaska in 1980s, I have mentioned this, that experimentation was done and a lot of elderly and young people were subjected to examination, and they found that the percentage of myopia condition was maybe 1% or almost in decimal. But in their children, it was more than 20-30% in Alaska. And then they established that no, they can control it if they change their lifestyle, and they found two very dominant factors. First factor, near-sight work. Near-sight work is playing very important role. Means most of the time your child is indoor, inside house, in a small compartment, in a room 12 by 12, and always he is sitting in front of electromagnetic radiation, either in front of TV screen, in front of iPad or laptop or your smartphone, that is either Galaxy or iPhone. And all these electronic gadgets, instruments, they are all producing electronic image and electromagnetic radiation. It is continuously falling. And this one, they are going to have effect more especially on lens and cornea. The muscles and their size and their shape, especially the cornea will be D-shaped. And one factor is playing very important role. That is called brightness of the light or illumination of the light. And this is the latest concept what they found. For example, in one room, to one place, you are putting one source of light, bulb or tube light, and somebody is sitting under there in 1 square meter. He is getting a lot of brightness rather than the one who is sitting some few meter away. That brightness will be drastically reduced. But overall, if suppose it is daytime and you are inside room, your illuminating brightness is calculated, that is called 1000 lux. In room, that is called 1000 lux. This lux is the unit of illumination. That is luminance and that is in flux. And that one, when in ISI it is calculated, means in 1 square meter, one that is lumina is falling, and that is called your lux. So that is in 1 square meter. And whatever lumina is falling here, that is called lux. So in your room, if there is no any bulb like daytime, so if during daytime your child is only in your that is called comfort zone. Out of luxury, he is addicted to his bed and sofa. Inside his very, very comfortable room where it is hot climate like Nigeria or India, AC is put, or maybe centrally the whole house is under air condition, and he is there. And he is playing with his electronic gadget, reading, writing, or watching. It is very, very dangerous, and definitely he or she will be having myopia condition. It means he is damaging and deteriorating his or her cornea size, shape, lens, nerves, muscles, retina, because of deficiency of brightness, and that is calculated in 1000 lux. If you sit in veranda outside house under shade, so under shade, it is your 10,000 lux brightness. It is very important, this calculation of wavelength and frequency of brightness, and that plays very important role for your eye. That I have already delivered one lecture, the role of sunlight. I call sun the father of all activities and all living organisms, even plant material. If sunlight is not there, nothing will survive. So here also, if your children, that's why this number is very much increasing, because is the symptom of luxury and comfort life. And excess of anything and everything is bad. Whether it is luxury, whether it is comfort. You have to sacrifice for your survival. Ask yourself to go and spend at least 2 hours outside. Even if it is sitting under some veranda or under tree, or playing some game in park, when they are in the age group of 5 to 14, 15. That is the most important measure to handle this myopic condition of children. And if suppose your child is going, that is under sun, he is getting brightness of 100,000 lux. So exposing yourself means your children, early in the morning under sunlight or before sunset in the evening is the best option, because you are going to get, if you are exposed to sun, 100,000 lux brightness, and that will clear everything. There will not be any problem of such type of de-shaping or making all the eyeball and everything loose and elongated. No, it will take care. So this is what we call it, that is near side work, means very close inside room. You are reading, writing and working, and you are not exposed to high intensity brightness that is calculated in lux. And inside house, every house anywhere, once it is indoor, it will not cross more than 1000 lux. Once little you are outside house, immediately the brightness will go up to 10,000 lux. The moment you are under sunlight, it is 100,000. So it is a must to expose at least few minutes under sunlight. I am not saying that you go at 1 or 2 p.m. when the sun is directly falling and you get sunburn. No. Just early in the morning or evening, or sometimes under shade, under tree. If you are sitting under tree in your garden, in your kitchen garden, anywhere, or in your balcony, you are exposing to at least 10 to 40 thousand lux brightness. And that brightness is going to take care of your eye health as well as your lot of other medical condition like vitamin D. You are exposing to sun, I call vitamin D, that is sun vitamin. Your mitochondria will be producing lot of energy. So all these factors are very, very important. So here please, these are all three factors, and after all these, once it is noticed that your child is having difficulty in identifying the object at distant place, it means he has myopia condition. Go to your ophthalmologist. He will immediately correct everything, his lenses, eyeglasses, and it will be normal. And with eyeglasses you can manage for whole life. But if you have not taken care in the beginning, then definitely the damages will be more. And if it is in chronic condition, then there will be high grade or low grade glaucoma, and finally the damage of retina, and that damage of retina is called detachment. So it will be a serious condition, and then you are going on the road of blindness. So please don't take it lightly. Always take it very seriously. Once you came to know that your son is having or your daughter is having such type of eye problem. I am going to show those photos. So here I am showing you very clear image of eyeball, and if the eyeball size is mismatched, is bigger size, there is chance of that is myopia, means short-sightedness, where the focal point will be shorter. It will not reach to retina, and that I have already showed you the diagram in the previous lecture. So here in this image of the eye, very clear the shape of the cornea and how it is, that is a curve shape, and it is not we can say straight or bent. This is normal condition, and lens, iris, all are shown. So main I am concerned with cornea shape and its bending condition. So you can see very clear picture of cornea. There are three pictures, images. One is first on top, that is little bit flattened. It is the abnormality of cornea, and if child is having such type of cornea which is flattened, there is chance of myopia. And the second one is that is curve. So if it is having lot of curve, again the enough light will not be bent to have the proper focal point. And the last one is that is proper this cornea shape. So cornea shape plays very important role, because 70% bending of your light rays is done by your cornea shape. So cornea shape is the most important for this. Yeah, this image is where someone is suffering seriously in chronic condition of retina detachment as well as followed by glaucoma. So retina detachment means retina is damaged. You will be having lot of blood capillaries here and there in very red eye. So that is the chronic condition. So in this image very clear, where you can see the arrow. Arrow is showing where your retina is detached. It is not in the same lining, rather than it is only that condition. That is called retina detachment, and once it happens, then your myopia condition is in very chronic condition and it is really towards blindness. So here I will stop, but my request to all parents that they should have a regular checkup of their children's eye, and as a parent they should always guard their children at how much they are using the electronic reading or electronic images, and they are always inside, push them to go outside and play and sit outside, spend some time outside, at least 2 hours time. They must spend 2 hours time outside house. That is called outside factor. And I have already told you, again I am repeating, your child's cornea is playing very important role. It has 70% role of bending the light to bring to focal point, and if it is not correct, then the focal point will be short, it will not be falling. That's why it is called short-sighted on the retina. And in chronic condition, you discuss with your ophthalmological surgeon. And here in Maiduguri, in Nigeria, I was shocked to see that one gentleman, he was just testing the eye, and he said that I am ophthalmologist. I said, no, I cannot accept you. You are just testing with the help of eye box. You are only diploma holder of optometry. So sometimes for eye, there are a lot of confusion. Make sure that if there is any serious problem, go to any good government hospital and make sure that your eye doctor, I call it, or we can say ophthalmologist, he or she is qualified and they have at least postgraduate degree. If he or she is surgeon, they should be ophthalmological surgeon, not general surgeon. And if someone is in medicine, he should be experienced postgraduate ophthalmologist. Is because even in India, also in Nigeria, lot of problem is there, because all these people who are having diploma in optometry and they are posing themselves ophthalmologists is wrong. Why I am saying? Because I came across 2 Indians who were in Maiduguri, and when I crossed them, I told them, please, better to leave this place. They were not ophthalmologists, and they were posing that they are ophthalmologists. And people, some of the educated people, they were going and getting diagnosis, opinion. They can only correct your convex and concave lens, and they can make the lens with the help of trial box, nothing else. So please take care of this. Once again, thank you very much for watching the lecture.